I'm Dr. Tiffany Pan. I'm an orthopedic surgeon specializing in treatment of conditions affecting the hand, wrist, and elbow here at OrthoVirginia. It's my pleasure to welcome you today to our Facebook Live from our new Alexandria office in Northern Virginia. For those who might not know OrthoVirginia, we're the largest multi-specialty orthopedic practice here in Virginia. We have locations conveniently all around Northern Virginia, as well as offices in Richmond, Lynchburg, and Virginia Beach. We're also the official sports medicine providers for DC United. I don't want to take up a lot of your time telling you about us, but if you want more information about OrthoVirginia, please go to our website, www.orthovirginia.com. Now let's get talking about you. Today we're going to be talking about carpal tunnel syndrome, the signs and symptoms, when to see a specialist, about issues with your wrist or hand, and different treatment options that you have. So before we jump into the tips and your questions, let's not forget about your friends. If you have any friends who are having problems with their hand or wrist or think they might have carpal tunnel, you can share this live event with them by clicking on the button below. So what is carpal tunnel? It's a term that a lot of people have heard and they attribute it to a lot of different things. People have hand pain, wrist pain, they say, oh, I have carpal tunnel, but what is it really? The main issue with carpal tunnel is that your nerve gets compressed in the palm, right in the middle here. It's a nerve that feeds feeling to 1, 2, 3.5 fingers. So typically the symptoms are numbness and tingling. Those are what most people present with. The carpal tunnel makes basically a box. So the bottom of the box is made up of your wrist bones. So those are static, they don't move. The top of the box is a ligament that goes across, and over time or for different reasons, sometimes that can thicken and press down on the nerve underneath of it. In addition to the nerve that goes through that space, all the tendons that bend your fingers go through the same space. So the tendons become inflamed or swollen, such as if you do a lot of repetitive movements. That can also irritate the nerve that runs right next to it and cause similar symptoms. So in a sense, carpal tunnel and tendonitis go together, but usually carpal tunnel is what we refer to as the nerve symptoms. So this is a very common condition. There's over 200,000 cases a year. It's actually, in the past, has been the second most common cause of days lost from the workplace, and people would miss between an average of 3 to 4 weeks because of this condition. There are a lot of different risk factors for it. Most of the time we don't know what causes it, but there are certain occupational factors such as using jackhammers or doing a lot of repetitive motions with your hands, pregnancy, older age, female gender, family history, different aspects of your anatomy if you have a big hand, small hand, as well as conditions that affect your whole body such as diabetes or rheumatoid arthritis. Those can also be associated with carpal tunnel syndrome. So when do you see a doctor for this? Well, basically if your hand doesn't feel good and you're tired of putting up with it, you should probably just go ahead and see a doctor for it. There are a lot of different things that can cause your hand to not feel well, and some of them may be carpal tunnel. But again, the most common symptom that people present with is numbness and tingling. So a lot of people will say, when they're driving, their hand falls asleep. When they are using their phone, their hand falls asleep. Or if they're talking on it, they get these pins and needles. A lot of people, when they come in, it's because they wake up in the middle of the night with pain. They have to shake their hand out when they get up in the morning. It takes a while to wake it up. It feels very stiff. You drop things. Difficulty buttoning your shirt, or like if you're trying to do fine motor skills, you might have difficulty with that because your fingers feel numb. There are a lot of different treatment options for carpal tunnel. Simple ones that we start out with, sometimes anti-inflammatory medications. Again, that goes along with tendonitis issues. Night splinting is a big one, so a lot of people will say, oh, I have a splint to wear for my carpal tunnel. Primarily we advise people to wear it at night because at night your wrist bends, which pinches off your nerve even more, which makes it angry all day long. So they tell you to keep your wrist in a pretty neutral position at night. That allows it to rest. Hopefully keeps you from waking up in the middle of the night and makes your nerve feel better during the day. Also with working from home, a lot of people are having tendonitis and carpal tunnel symptoms because of their workstation. So they're not set up the way they used to be. They're using their laptop on their couch. Their wrists are like this all day long. So there's a lot of different things such as exercises and positional factors that you can consider in trying to get those symptoms to go away. On the more invasive side, you can get injections for carpal tunnel, and there is surgery, of course, to treat it, which not everybody ends up needing. So don't be afraid that if you come in, you're definitely getting surgery. Most of the time, people don't actually need it. So that's basically the rundown on carpal tunnel. I think our takeaway tips are, again, make sure your workstation is ergonomically friendly. If your symptoms just started in the last few months since you've been working from home, check to make sure your wrists are in a good position, that your wrists aren't bent or super extended all day long. Take time to do your exercises in the middle of the day. Symptoms can come and go, so when it flares up, take anti-inflammatories and wear your brace, do your exercises. And if they don't go away, then come in and see us, and we'll take care of you.
Awesome. So we have a few questions for you, Dr. Pan. So first one, does night splinting help?
Night splinting does help the vast majority of patients. So again, in the middle of the night, people's wrists tend to bend down like this, which pinches off that nerve even more that's already feeling a lot of pressure. So what the splint does is it puts your wrist in a more neutral position and allows that nerve as well as the tendons to rest in a neutral position, and that usually makes people feel better all day as well.
Awesome. So using the regular mouse hurts my hand. Is there anything I can do? Using the regular keyboard hurts my hand as well. What can we do for that?
Yeah, everyone's a little bit different, but some patients have reported that the vertical mouse seems to be very helpful because you're able to rest your wrist in a more neutral position. As far as the keyboard, again, laptop keyboards are probably the worst. Full-size regular keyboard where you can put it further away from you or have your wrist in neutral position is better. I tell people put a support under their forearm to keep their wrist in neutral position. Sometimes wearing the brace during the day can help, at least so you find a position where your wrist is not too bent or too extended. And then after you find that position, you don't have to wear the brace anymore, but just gets you in the right place to get your workstation more friendly.
Awesome. So if you do have to get surgery, what is the typical recovery time?
So the typical recovery time after surgery is generally about 2 to 4 weeks. We just want to let the skin heal. So because the procedure is a release, there's nothing that needs to heal inside of you. It's just letting the skin heal. And so people are able to use their fingers right away and use their hands for light activities, but want to avoid any heavy gripping or lifting for 2 to 4 weeks.
Awesome. So what are some exercises for carpal tunnel?
So the main exercises that people do are intrinsic stretches and tendon gliding exercises, which if you've ever been in to see me in the office, I show pretty much everybody. But essentially they're exercises to stretch the little muscles in your hand, which can also affect the nerve, as well as to put your tendons through a full range of motion so that they're gliding better, so there's inflammation within the carpal tunnel, they won't stick together, and the symptoms will usually improve with that. And we have hand therapists here at OrthoVirginia who can take you through those exercises or give you a home exercise program. And again, I show people in the office these exercises all the time. They're easy to do.
Awesome. So is it helpful to use a particular type of mouse? We kind of answered this, but do you have any?
Not a particular type of mouse. Again, it's more about finding a comfortable position and keeping your wrist a little bit more neutral. So depending on your hand size and flexibility and all that, different mice work for different people.
Awesome. Can shooting pains in the hand be caused by carpal tunnel?
Yes, shooting pains can definitely be caused by carpal tunnel sometimes because nerve pain can present as numbness, tingling, burning, shooting. Sometimes it can go with the forearm towards the elbow. If you have a lot of that, you should definitely get checked out.
Mm-hmm. So the exercise you just demonstrated, does that also help for after carpal tunnel surgery?
Yes, it certainly can because people can get stiffness and inflammation after surgery as well. So those are exercises I often have people do early on to get their range of motion back.
Perfect. Can massage play a role in assisting to alleviate pain?
Massage, not directly, because it's a nerve compression issue. You don't really want to massage the nerve, but certainly if you have tight muscles in your hand, that can be helpful, or even in your forearm. As long as it doesn't hurt you, it's okay to do. But there's nothing specific that we recommend in that regard.
Awesome. So what is the success rate for carpal tunnel surgery?
It's actually very successful. So when you really have nerve compression and you have numbness, tingling, night pain, I would say 99.9% of my patients get better after surgery. So that is, their night pain goes away, their tingling improves, their numbness usually improves, and some of that also has to do with how bad your nerve was beforehand, and if you have any other risk factors like diabetes, which could prevent your nerve from recovering completely. Now, a lot of people come in and say, oh, I have a friend whose carpal tunnel release didn't work, but there's a lot of people out there who, because it's such an easy procedure, are getting carpal tunnel releases for things that may or may not actually be carpal tunnel, or they might think it was carpal tunnel, but it wasn't. But when you truly have that nerve compression, it's a very successful surgery.
Awesome. So this is an interesting question. I just had my COVID vaccine. When is it safe to get a shot for my arthritis CMC joint?
Yeah, so there's different recommendations on that coming out right now. I believe the one that we're using is not within 10 days either way, before or after your vaccination. Um, there's obviously not been any strong studies done on this, but this is the recommendation that's coming out from the hospitals.
Awesome. So what are the causes for hand muscle spasms?
There can be a lot of different causes for hand muscle spasms. Carpal tunnel doesn't normally present with spasms, but it can feel like that. So the best thing to do is probably to get checked out because that's a pretty wide differential diagnosis.
Awesome. What type of anesthesia is used for carpal tunnel surgery?
Typically, sedation with local anesthesia. So most people will want to be a little bit sleepy for it. You're still breathing on your own. You're not intubated, but you're just sort of unaware of what's going on. In certain cases, we do this procedure under straight local anesthesia. Just kind of depends on you, the size of your hand, and how bad we expect it to be.
Awesome. I just have wrist pain, no hand or fingers pain. Can that be carpal tunnel?
Potentially. It could be sort of the early stages, or again, it could be related to tendonitis, which is also related to carpal tunnel. Um, but there are a lot of different causes of wrist pain. It depends on where the pain is, so can't say for sure.
Awesome. Can carpal tunnel reoccur?
It can. So the surgery is to release the ligament, and basically what you do is you cut it on the one side. It opens up like a trap door. Over time, that can scar back down and thicken again. Typically, true recurrence we tend to see after a few decades. So I'll see people 20 or 30 years later where they really scarred back down. Now it's pressing on the nerve again. But a lot of people who say it came back, maybe having more symptoms of inflammation or tendonitis, again, that can still occur. And some people maybe didn't have carpal tunnel to begin with, got the surgery, and then say it came back but never really went away. So that might be a different cause altogether.
Awesome. So how do you diagnose how far progressed the carpal tunnel is and whether or not it needs surgery? So kind of different stages of carpal tunnel, I guess.
Yeah, so primarily it's a matter of your symptoms, but we also frequently send people for nerve studies, which is basically an electrical evaluation of your nerve to see how well it's conducting signals past your carpal tunnel. So that can give us some information on whether the muscles are still healthy that are being fed by the nerve. If the muscles are starting to show changes, you're probably very advanced. If your nerve is not conducting the signal at all and they can't record it, that's also very advanced. And then we might say, the chance of it recovering fully is probably lower. Most people are going to fall into a mild to moderate category, and then it just depends on how bad your symptoms are, and if you've tried the other treatments and failed those, then frequently people get a carpal tunnel release once they have tried everything else and doesn't seem to be working anymore.
Awesome. How can swelling of the hand be reduced?
Swelling of the hand has a lot of different causes. Carpal tunnel can definitely cause a bit of swelling, in which case we would tell people to wear the brace at night and see if that helps. In general, you can wear a compression glove. The exercises also help because if you have stiffness and you're not moving your fingers, the fingers are the pumps to the hand. The hand doesn't have or the fingers don't have any muscles to pump blood back themselves. So if you don't move your hand and make a fist, the swelling will persist. So there's a lot of different causes, a lot of different treatments for hand swelling.
Does carpal tunnel radiate up into the elbow and upper arm?
It can radiate to the elbow. Typically does not radiate to the upper arm. Once you start getting up there, we start to consider if it's coming down from your neck or something like that. But I have had quite a number of patients say that it goes up to their elbow.
Awesome. You mentioned if carpal tunnel release doesn't help, it may not have been carpal tunnel. What are the other types of causes that cause similar symptoms to carpal tunnel?
Tendonitis, again, is a big one. You can get tendonitis in the wrist that can cause symptoms that are similar. Sometimes you have, again, those sort of more internal issues like rheumatoid arthritis or diabetes, neuropathy, things like that. So sometimes, it looks like median nerve compression, but maybe the problem is actually inside the nerve or with other structures around the nerve, in which case just taking pressure off the nerve may not help.
Awesome. I've been using the night splint and it was helping, but occasionally then the pain shoots up my arm past the wrist, then the splint isn't as effective. Is the change a possible indication that it isn't carpal tunnel or more that it's progressing past the point where that treatment was still working?
Yeah, it's possible that it's progressing past the point where the treatment was working. Typically with splinting, it works pretty well until it doesn't. And then once it doesn't, then you start waking up at night again, shaking your hand out in the morning, might get that pain shooting up the forearm. It's hard to tell.
Mm-hmm. My hands tingle and go to sleep at night or early morning. Is that carpal tunnel?
Most likely.
Yeah. Mm-hmm. Awesome. Hold on, I have a few more questions. My wrist hurts when I'm knitting. Should I wear a brace? How do I know if a brace is a good brace?
You can certainly try a brace. Knitting puts your wrist in a lot of flexion typically, and so it might just be the position that you're in, and it's very tense. If you're gripping your needles very hard, that can cause, again, sort of tendon irritation issues. Um, you can get a lot of braces over the counter, and there's a wide variety of them. So finding one that fits you perfectly can be a bit challenging. But I would try different types of braces, and if you have not found one that works for you, come in and see us. We can also fit you with braces here, or therapists can make custom braces if you can't find one that works for you.
Mm-hmm. So another brace question. Could the wrist brace I wear support while exercising with dumbbells, planks, etc. be aggravating my carpal tunnel pain?
Possibly. Not necessarily the carpal tunnel pain itself, but whenever you wear a brace for activity, depending on if you're still trying to fight against the brace while you're doing it, that can cause pain, or it might not fit correctly, and then that can cause other types of pain. Sometimes if you immobilize too many structures too stiffly, then your body starts to react to that, and then you have stiffness issues and pain from that. So there's a lot of different factors that go into that. Hard to answer without seeing it.
Okay. Does carpal tunnel have anything to do with your shoulder or even shoulder blade?
No.
So any times that symptoms would go up the arm all the way to the shoulder, or that's a different issue?
Well, again, when it starts getting up to the shoulder, we start thinking of it's coming down from the neck. So, yeah, carpal tunnel is specifically where the nerve gets pinched at the palm. So while that nerve does run all the way up, usually the symptoms won't travel like that.
Mm-hmm. So do you see any types of jobs or occupations that more commonly have carpal tunnel? Like, do you see an artist or...
Yeah, hairdressers get it a lot. Manual laborers, people who work with vibratory tools like jackhammers, that's the classic ones associated with it. People usually think it's related to typing and such, but that actually has not been shown to be a strong risk factor, although again, the workstation setup and all that can contribute to it.
So follow up to the hands tingling at night. They actually go numb and have severe pain along with it. Do you think it's carpal tunnel or arthritis?
That sounds like carpal tunnel.
Yeah.
So we could also rule out arthritis by getting x-rays, but usually night pain and that wakes you up, very frequently carpal tunnel.
All right, a few more questions. Generally speaking, how do you know when it's time for surgery? I had pregnancy-induced carpal tunnel that never went away and continues to bother me. My fingers are numb, tingly almost all the time now.
Yeah, so when is the time for surgery? That's definitely something between you and your doctor. It depends on a lot of different factors like your life, what you can do, what treatments you've tried, how aggressive you're wanting to be, what your nerve studies show. Certainly if you've tried a lot of different treatment options, and pregnancy is a special case because most of the time people will get better after delivery, but not always. So in those cases, sort of a special evaluation and consideration of different factors like breastfeeding and whether you can undergo surgery. But certainly something to consider if you failed other treatment options and it continues to bother you and you have constant numbness.
So what causes arthritis of the thumb?
A lot of times it's genetic actually. People seems to run in families, but in general, no one really knows what causes arthritis of the thumb because nobody walks on their thumbs, so it's just one of those things that some people tend to get, but it's actually very common in general. So,
could you please demonstrate the proper way to support your wrist, hands while working on a laptop? We don't have any mouse pads here, but
yeah. So in general for laptops, you don't want to put it on your lap because then your hands are going to be in this position. So basically you want them to be relatively in a neutral position like this. So laptops are hard because they naturally make your wrist flex like this. So if you can prop your laptop up a little bit so your wrist is in a neutral position, that can be helpful. As far as the mouse goes, again, trackpads are really terrible. So a full-size regular mouse where you can control your wrist and hand position is going to be better. But like we talked about, everyone's got different size hand and different mobility in their wrist. So.
Awesome. So can a finger that is bent due to carpal tunnel ever fully recover?
A finger that's bent?
Yes.
Carpal tunnel doesn't usually cause bent fingers. That may be a trigger finger if it's something that gets stuck like this and then snaps back and forth. Um, so I'm not sure that carpal tunnel release would actually fix a bent finger. Probably evaluate for that.
Okay. If you got carpal tunnel after pregnancy, will it likely come back if you become pregnant again?
That's an interesting question. I don't know the data on that, but it does not seem to necessarily come back every time you get pregnant. A lot of times it's more common with your first child, but that may be anecdotal. So no, if you got it with your first one, it's not guaranteed that you'll get it with your second one or anything like that.
So going back to the trigger finger, is there any relation of carpal tunnel to trigger finger issues?
Not directly, but they're both very common, so they frequently are seen together. Now the tendon does run through the carpal tunnel and then up into the trigger finger, which is another tunnel issue. So in theory, some people, when they have a lot of inflammation and swelling their tendons at their wrist level, will get what feels like trigger fingers up in their fingers, and that can improve after surgery. But if you're, tender over here and have clicking and all that, then that's probably a separate issue that just happens to be occurring at the same time.
Awesome. So this might be our last question. Once you have carpal tunnel surgery, is there any chance those symptoms return in the future?
Yeah, so we talked about recurrence earlier. That it can come back. Usually after, I would say 20 or 30 years is when I commonly see it, because that ligament can scar back down and thicken again. And also depends on how bad your symptoms were beforehand and what your nerve study showed. Sometimes people won't make a full recovery because of the amount of damage that's been done to their nerve. But otherwise, typically people do get good relief out of it, and for many it's permanent. So.
All right. Well, that was our last question.
All right, great.
So thank you guys for watching. And if we didn't get to your question, we'll answer it later in the chat.